Talk about it. You know life has its ups and downs. Turn your pretty face to an ugly frown. Seems that when I fix one thing.
Hello, welcome to The Awakening. I'm your host, Angela Brown. Today's topic for discussion on The Awakening is breast care. It's a very, very serious topic because all of us never know, from 1 year to the next, when we go with a mammogram, are we going to be okay? So I have a doctor here. Her name is Regina Hampton, and she is a fabulous lady. She owns the Breast Signature Center, and she does nothing but breast exams and breast care. I want to welcome you to The Awakening. You're so pretty.
Oh, thank you so much. Thank you for having me.
Oh, you're welcome. Tell my viewers a little bit about Signature Breast Care.
Well, Signature Breast Care is a practice that is dedicated to breast care only. I'm actually a surgeon, and so I do the surgical management of breast disease, both benign, non-cancerous, and of cancerous masses and conditions. We take care of both men and women.
Do men get breast cancer?
Men actually do get breast cancer. They get it at a less rate than women. It's only about 1% of the total breast cancers that we see, but breast cancer is real in men.
My goodness. Where did you go to school to become a surgeon?
I did my residency training at Howard University.
Good girl. That's great.
And I did medical school in Philadelphia.
That's good. What got you in this field?
Well, I discovered that I liked surgery in my third year of medical school. I discovered I really like working with my hands and taking things apart and putting things together. And about a year into my practice, I discovered that I liked taking care of women that have breast issues. And so as of January 1st of this year, I converted my practice from a general surgery practice to a breast-only practice.
That's wonderful.
And it's been very rewarding.
I can see it in your face. You enjoy what you do. You know, like I told you before we went on the air, it's very scary when it comes time for the mammogram. We all are frightened. Do you still have problems with that yourself, or?
I do, probably not as much as other folks, because I sort of see it and live it every day through my patients. But one of the things that I tell patients is when you get an abnormal mammogram is to first just take a deep breath. Just because you have an abnormal mammogram, it doesn't necessarily mean that there's anything cancerous there. It just means that we need to investigate a little bit more. They may want you to come back and get additional films done, or they may want you to see a surgeon to get a biopsy. The good thing is that most of the biopsies we do, if we were to have 10 women in here who had an abnormal mammogram and needed a biopsy, 8 of those women would have normal findings, and only 2 of those women would have cancer. So those are pretty good odds.
Okay. But is that, I don't know if it's good odds or not. If there were 10 women who needed biopsies, 8 would be okay and 2 would have it.
Correct.
Why couldn't all 10 be okay?
Well, we're working on it. We're trying to get there. We haven't gotten there yet.
What about breast cysts? Do they show up abnormal on the mammograms
They
as well?
do. They do. And that's the most common thing that we see are breast cysts. And breast cysts can cause breast pain. And so most people that we see that have breast pain, it's usually due to cysts, or what we call fibrocystic changes in the breast, which is a benign finding, very common, especially in African American women that have what we call dense breasts.
Let's go back there. Why are the African American people so more susceptible to different kinds of cancers and, you know, all kinds of diseases, and we're not, the Caucasians? Why is that?
Well, I think it's a very complex issue. I think one of the things is we're not taking good care of ourselves. We're not, in the form of breasts, we're not doing our breast self-exams. We're not going to get our mammograms on time. When we feel something, we're afraid to go get it checked out because we're afraid that it may be cancer. I think there are a lot of cultural issues, a lot of myths in the African American and the Hispanic community that prevent women from going to get their mammograms. I can't tell you the number of women who come into my office and say, well, my grandmother or my mother said that mammograms cause cancer, and so I'm not going to go get one.
The radiation, yes, yes.
Yes. And the radiation now is so low that we think that the low amount of radiation that people are getting on mammograms, it's worth the risk considering the number of lives that we're saving.
Right. But what about the women who don't have money to go get a mammogram? That's what bothers me.
Well, in the state of Maryland, there's a program called the Breast and Cervical Program where a woman can get a mammogram and a pap smear when she doesn't have insurance.
She can get a breast and a cervical exam?
Yes.
And what's the name of the place again?
It's called the Breast and Cervical Program.
The Breast and Cervical Program. Please remember this if you don't have any health care and if you need a mammogram and a pelvic exam.
Yes.
And a pap smear, you can go there and get it for free.
Yes.
Thank you for saying that because I know there are many women right in this area who don't have the money.
Yes.
Who have no health care.
Yes. And what's nice about the program is if there's anything abnormal, they will pay. You know, if you need additional studies done, if you need treatment, they will cover that treatment.
They cover all of that.
They do.
That is fabulous.
They do. It's wonderful.
It's wonderful. Do they have something in the District of Columbia because they say it's running rampant there?
I believe DC has a similar program, and I know that they're trying to get these programs in all 50 states.
So they run on donations, I would guess, from people.
I believe it's through state money. State funding.
State money?
Yes.
You hear that, Mr. President? If we need more state money, get it for us. Women, we need you.
Yes.
He is such an open person.
Yes.
I love him for that reason.
Yes.
He's easily, I'm going to write to him and invite him on the show.
Oh, that would be great.
I think he will come.
He probably will.
I think he will, and bring his beautiful wife with him.
Yes.
But getting back down to serious things, so how long have you been doing this? 10 years, 15 years?
Actually, I've been out of residency since 2005.
Because you look so young.
Oh,
you look
thank
like you're
you.
about 20,
Oh,
23.
you're too kind.
No, you do. And your voice is like a little girl on the phone. Because when you called my house this morning, I didn't realize who you were. I went, who? Who? I thought I was talking to a little girl.
Thank you.
Okay, so if we have 10 ladies come in, and 8 will be okay and 2 won't. What do you do after that? What happens after that?
So once we've made the diagnosis of breast cancer, and let me just state that when you need to get a biopsy done, that women should try to get a minimally invasive biopsy, meaning you shouldn't be taken to the operating room to get your biopsy done. It can be done in an office or in a radiology center with local anesthesia, and we can get the answer by doing a needle biopsy.
Why should they do that compared to the other way you just said?
Well, because since most of the biopsies we do are going to be negative and benign, it just prevents the risk of anesthesia that goes along with having surgery, a lower risk of bleeding, and we can get the answer by doing a needle, which is less invasive and less scarring on the breast. Is that what you do in your office when you do that? Yes, I do. I do them in the office, and then I do them at some of the local hospitals as well.
What wanted you to choose this specialty?
I felt like in this area there weren't enough people that were focusing on breast care and giving women the time that they need. I found a lot of my colleagues will tell a woman, you have surgery, let's take your breast off. And it takes a lot more than that. It takes, sitting and having a discussion, what are all the risks, the benefits, sometimes dealing with some of the family issues and social issues. And so I just discovered that I have a passion for it, and I love to watch the women as they move through the process and how they go from feeling sad and anxious and upset to, 6 months down the line after they've gotten through their treatment, they're happy and they're living full lives and taking care of their families, and so I love it.
Okay, I see you love it. I can tell it in your face. Where is your office located?
My office is in Greenbelt, Maryland.
Oh, I know where Greenbelt is over there.
Yes, not too far
There's
from
a lot
here.
of wonderful office over there.
Yes.
Okay, is there a difference in diagnosis rate of survival rate between Caucasian women and African American women?
There unfortunately is. When we look at 5-year survival rates, it's 90% for Caucasian women and 77% for African American women.
But why?
Again, we're not going in and getting our mammograms. We're not being, our cancers are not being detected at an earlier stage because we're delaying and waiting. And to me, those numbers are just unacceptable. I don't see why we can't be at 90%.
I don't see why not either.
And I think it's going to be a matter of us being proactive. We've got to stop being fearful. And I always tell patients, what is it that you're afraid of? If you're not getting your mammogram, are you afraid of living or are you afraid of dying? Because if you're not afraid of living, you'll go in there and get that mammogram because it will save your life.